I feel like I'm prefacing every single lecture that I'm doing on first aid with you should be asking people in your group when traveling in the backcountry if someone suffers from seizure disorders um, or whatever potential disorders and know what you're getting yourself into as a group. But most people have had seizures before. It's not necessarily something that they see for the first time. I mean, obviously, there has to be a first seizure, but most people know that this is something that they're susceptible to. Okay, so knowing that ahead of time is important. Knowing what triggers it, how to treat it, and how you know if someone is starting to have a seizure. So, that being said, the biggest things to remember is that you need to let a seizure run its course. Okay, so there was a time when people said that you could swallow your tongue when you were having a seizure, and we needed to put something in that person's mouth. That is not the case. You physiologically cannot swallow your tongue. There are issues with the people biting their tongue or their lips or cheeks and bleeding, and that being an issue. But either way, there's nothing that you can do to prevent that. And putting something in someone's mouth is a choking hazard. So letting the seizure run its course, it's usually relatively quick. It won't feel quick at the time, right? But the biggest thing you can do to protect them is to keep them away from anything that is unsafe. Obviously, that's the same in the front country, but in the back country, we run into some other issues to what could be happening and exposure to some pretty serious factors that can influence a seizure. So when the seizure is over, you want to check the person for responsiveness. And so, like we did in our patient assessment, right? Are they alert? Are they able to answer your questions? Do they know where they are? Or do they take a while to come back to? Okay. Um, Put them in the rescue or recovery position so that way they can get become more aware of their surroundings and come back to. They may have a second seizure. That's not unheard of. Okay. I should note that in the backcountry, the most likely left off a waiver is the most likely symptom. I'm sorry, the most likely disorder left off of a waiver is a seizure disorder. When people openly ex- when people openly have seizure disorders, a lot of times they'll lose their license, and some other issues can come from that. And so people typically keep this to themselves. It's important to talk to people ahead of time and say, hey, like, we're going into the backcountry. If there is anything, I need you to be open and honest with me. It's not my intention to get you in trouble. So with seizures, in the front country, you always 100% of the time call 911. If the seizure lasts for more than 5 minutes, or the person has multiple seizures, automatic 911, right? If the person became injured during the seizure, automatic 911. If the person is unresponsive after the seizure, automatic 911. If the person is pregnant or has diabetes, automatic 911. In the back country, a seizure is always an evac, okay? If someone has a seizure, even if they have a seizure disorder, there's a chance that they'll have another one, and we need to get them out of the back country. If any of the bullet points on the screen are present in the back country, then it's a rapid evac, right? So remembering the differences between those. So an evac is I can take myself out, maybe with some help from a colleague or a friend, maybe someone carries my pack, but I can hike myself out. A rapid evac is this is detrimental, life threatening, and we need to call for rescue services. Fainting or becoming unconscious. A person who is about to faint may become pale, sweat, and complain of dizziness. There's usually something that is triggering the fainting, and it might be some of the disorders that we have or issues that we have talked about previously. Could be diabetes, could be seizures, and so on and so forth. Okay. Um, you may be able to prevent this person from fainting. Have them sit down, put their head between their knees, or lie flat on their back. So, trying to get blood flow to their head, trying to get them to relax, bring their heart rates back down. If the person is responsive, um, Check the person for any sort of injuries after fainting. So go back to that patient assessment, right? Everything starts with that patient assessment. Going through every single step, unless there's an ABC issue, we continue through, get that history, and so on and so forth. Always put the person in recovery position. That's our go-to position. Remember, this person fainted, right? They likely fell. So we need to be checking them, and we need to put them in a position that allows them to recover. So call 911 if there's any doubt about the person's conditions. In the backcountry, if the person fainted, we rest and then we have a conversation with them. What triggered the faint? Okay, we wait time. We likely will evac someone who fainted, but if we can find the trigger of that, maybe there was an issue with someone's pack that cut off blood flow. Maybe the person didn't eat a proper amount, and so once we fed them, once we've rested, they're fine. They feel like they can continue. That is a possibility, but more often than not, we are going to evac that person. Okay. If at any time the person became unresponsive, begin CPR, immediately an AED if you have that in your backcountry setting, and if not, then you call for rescue services.